Hi, good afternoon, everybody. My name is Janet Kenefsky, and I'm the Vice President of Operations for the Greater Vancouver Chamber of Commerce. Thank you very much for joining us today. Today's Mind What Matters webinar is brought to you in conjunction with Maul Foster and Alongi. We're excited that Maul Foster and Alongi reached out to us in order to bring some critical information to the community regarding opening our businesses safely during the phases of reopening in Southwest Washington. So we're probably in one of three different categories, most of us that are on the webinar. We could be reopening for the first time through COVID just now as we reopen in phase 2. We could be waiting to reopen, and we could have been open all along, listed as an essential organization. For us, it's really important at the Chamber of Commerce, and I know it's important to those of you who are on this video, is to make sure that we reopen safely, and we make sure that we're reopening with the interest of keeping both of our staffs and our customers safe during the reopening. There's a lot of questions that we have in this community regarding what does it mean to safely reopen? Am I ready? What steps do I need to take? There's a lot of information that's being thrown out to us through social media, through different avenues, a lot of portals out there. So one of the things the Chamber tries to do is partner with different experts in the field to make sure that we're getting valid data, data-driven information directly to the businesses here in the community. So with us is Maul Foster and Alongi. I'm first going to introduce Abby Russell, who is going to be joined by Bill Beatty, the Principal Industrial Hygienist for Maul Foster and Alongi. Abby, I'm going to give a little bit of background on you, so stay put for just a second. Abby Russell, so not only is Abby involved in the Chamber in a number of ways, but she's part of what we call our Public Affairs Committee, which is the legislative board that does a lot of advocacy on behalf of companies in our community to make sure that there's a healthy business climate. People might not know that we do a lot of setting legislative priorities that really mean a lot to companies, whether you know it or not. We're advocating for you behind the scenes, and Abby has been one of those people that has really taken the charge and developed these priorities with the companies in mind, not just Maul Foster and Alongi, but the entire Southwest Washington, Clark County community, which is really important. So Abby Russell has extensive strategic planning and community engagement background with media relations and crisis communications experience for a variety of projects and issues, from multi-million-dollar state highway projects and major natural disasters to real estate development projects and community events. With 15 years of hands-on experience in the construction, transportation, and port industries, Ms. Russell knows how to make communications a two-way street, engage diverse audiences, build relationships, and create constructive outcomes. Abby holds a bachelor's in public affairs from Washington State University and has worked with and for federal and state agencies, municipalities, nonprofits, and private businesses, which I think is really great for us as a chamber community to have somebody with your background and your voice here, Abby. So welcome. We appreciate partnering with you guys on letting the business community know on a federal and state level all the guidance that's coming at us, how to take that in stride, how to open safely and effectively, and be able to ask the experts today the questions that we all have on reopening safely. So welcome, Abby.
Thank you so much, Janet, and good afternoon, everyone. It is a pleasure to be here with you. Before we get started, we have just a few quick questions for you. So we're going to bring up, we have two polls here. We're going to bring one up, and you'll have a few seconds to respond. Bear with me here. Okay, you should see on your screen, do you currently have a written COVID plan? Yes, no, sort of. We'll just give you a few seconds to answer. Ooh, it's looking good. We'll share the results. Okay. And then we have one more. And I know this says what information would be most helpful to you, but if you could actually choose ones that would be helpful in general, that would be great and very helpful. And what we hope to do here is really get a sense of what it is that you're interested in, where you need help, and so we can really angle the information in this presentation toward that and hopefully be really effective and helpful for you today. Okay, I'm gonna go ahead and close that one. And now we're gonna see if I can actually share them. Okay. So here are the results. This is fantastic. I think we had about 67% said yes, they do have a written COVID plan. Wonderful, great job, everybody. 11% said no, and 22% said sort of. And in case you're sitting there wondering, or worrying that you're the only one that didn't have a written plan, we can see that that's not the case. And we're very excited to hear that 2/3 of folks who are attending today do have a written plan. That's wonderful. Now I'm gonna try to share the other one. Here we go. And we kind of figured that we would have some interest across the board here. Bad news, sorry, we're not therapists. We're not qualified to answer your questions on mental health, but we do know some good folks in the area. And other good news is that the Chamber, among others, have some resources that they can share with you on mental health, because we all recognize that that's definitely an aspect that we're all dealing with. But we appreciate you answering these questions. It looks like a lot of folks are really looking for ways to apply the information that we're seeing out there and understanding the regulations. And then, of course, finding resources and a good therapist is always helpful. Okay, thank you so much for answering those questions. We will look forward to hearing more questions from you throughout this presentation. We hope that you will have lots of questions for us. And just a reminder that you have a questions section on the little toolbar, probably on the right side of your screen. And if you have burning questions as we're going through this, please feel free to put them in the questions section, and we will answer them and try to get to them as we go through. But we also have a Q&A section at the very end, and so we're more than happy to continue answering questions there. And if we don't get to you while we're going through the presentation, we'll definitely get to you there and follow up as needed. So without further ado, I would like to introduce my colleague, Bill Beatty. Bill has 20 years of experience as an industrial hygienist, and he's been helping companies, including our own, create and implement reopening plans that help them comply with requirements and keep their staff, customers, and visitors safe. And besides being a very skilled industrial hygienist, Bill is also a very funny and insightful person, and I learn something from him every time we have a conversation. So, Bill, over to you.
Well, thanks, Abby. That was a very generous opening. I just wanted to let people know, I spent a lot of time trying to think through the best way to balance the need to stick to a manageable schedule with my desire to cover a lot of content. It's a struggle because there really is a lot of information to cover. So what I did, my clever solution was to keep the conversation at a fairly high level and move fairly quickly, but you're going to see that there are just tons of links embedded into these slides to allow you to have some ways to get to more detailed information as we go through. So hopefully that's a successful way to get the best of both worlds here. Our agenda today, if this moves forward, there we go. Our agenda today is to talk through some of the basic underlying background information that can be really helpful to inform your plan, and then move to the actual process of developing a plan. And a reminder for everyone, and I think we've already heard a little bit about this, just that the stakes are high. The consequences of an outbreak are quite serious, and that not only could it affect the people in the organization, it could affect the communities in which they live, and certainly the businesses could be severely impacted, whether it's for the individual business dealing with an outbreak or the region, as we see increasing cases. And here, as a matter of fact, we just heard yesterday that Governor Inslee is looking at implementing some new restrictions that should be announced today, if they haven't been already, to take effect as early as Thursday of next week for some of the counties. So stay tuned to hear some of the details on that. So I think all of us share the common goal of doing what we can to minimize the risk of transmission. Again, if you needed any convincing that the stakes are fairly high, this is some of the latest, greatest information about the reported mortality of COVID And as you can see, roughly 5% of cases resulting in death, and that's high. If you think about that in comparison to seasonal flu, which is typically around 0.1%, we are dealing with something that's quite serious. And here's some of the latest information about the spread, and you can see that the number of cases that we're experiencing today is in the same neighborhood as the number of cases that we were seeing in the peak. That bowl shape in the curve is certainly troubling, and that's why we're hearing so much discussion about do we need to do more to prevent spread. What's a little better news is this data on hospitalizations, and this is what a lot of people are also keeping an eye on, and this would be very troubling if we saw not just the number of cases, because people can understandably quibble about, well, does that really represent more about testing than it does about spread? And those are fair questions, but what really is more important is, are we looking at a situation that could overwhelm the hospital system? So people are keeping a very close eye on this. So anything that we can all do to prevent the number of hospitalizations would be really important for every reason. So here's the obligatory slide of COVID-19 with a link to the CDC website to stay up to speed on our understanding as this evolves, because the symptoms have evolved over time. Everybody's plan should include what these symptoms are, because every plan should include some element of symptom monitoring. But we need to recognize that symptom monitoring by itself isn't going to be your most effective tool, because there are a large fraction of people who don't demonstrate symptoms. They're asymptomatic. And what that number is precisely is hard to know. You can see here this reported range is quite wide, 20 to 80%. We don't really know exactly what the number is, but whatever it is, it's not trivial. So therefore, our recommendation is that you plan assuming that pretty much everybody can transmit as a carrier, and therefore really focus on minimizing potential transmission between people, whether or not they're exhibiting symptoms. The primary mode of transmission is person to person through respiratory droplets. And that term respiratory droplets does make me shudder every time I say it, because it just sounds so gross, but there you have it. And secondarily, contaminated surfaces. So plans should be developed around minimizing modes that could lead to infection. And there are many, many people and organizations that are providing guidance and help to us to implement these plans, and in some cases, implementing requirements for us. And here is my attempt to put together a few manageable buckets. And this is one of those places where I'm going to move through fairly quickly, but with the hope that you have time to go back later and click some of the links that I provided for more information. So just to zoom out a little bit, the best place to start if you're trying to wrap your head around these requirements is with the Washington State requirements. This is where we get the language for phase 1 through phase 4. It'd be great if we could sync up with Oregon, who has baseline in phase 1, 2, and 3, but what do I know? But these phases and the descriptions and requirements for these phases come out of the Washington State proclamations, and here is the most relevant to most of us as the transition from Stay Home, Stay Healthy proclamation and the phase-by-phase reopening. And that followed the Safe Start proclamation back in May. But there are a lot of proclamations. Most of them are more narrow in scope than these main ones. And I invite you to look at this link of all the proclamations and scan through it to see if you might be in one of those groups that would find a specific, more narrow proclamation relevant to you. But this is a great starting point for anyone who really wants to understand, okay, what am I supposed to do now? And then from that, you can take a look to see what the requirements are for you, and it depends somewhat on where you're located. So this is the latest, greatest map of the phases by county. So you can see that Clark County is in phase 2. And as you may know, there was an application to move to phase 3, and Clark County is still waiting to hear back on the status of that application. It's difficult to know if moving to phase 3 is going to be granted or not. Just again, given the increase in cases, I think we're all holding our breath, waiting to see what people, so to speak, of what we're going to see moving forward. So there's guidance for each of those phases. So once you know what phase you're in, and you should look to see if there's guidance for your specific business. And so the governor's website has a long list of resources for and requirements for businesses and workers. And so, for example, here's an example of a phase 2 in-store retail operations guidance document. And if I was that kind of a business, I would certainly be looking at this guidance very closely in developing our plan. Maul Foster, for our sake, we had to put together our own plan, and this was the guidance that was most applicable to us, was the professional services guidance. And if you go to that website, you're going to see that there are all sorts of good tools and resources, and one of them here is the phase 3 safe start plan template. So for developing a written plan, particularly if you're a relatively simple organization, this template might be just the thing for you. Go to it. It's pretty straightforward. You can see the different categories of information that you're expected to have. And it might be all you need to keep you on track in developing a good plan. You'll notice on the slide that there's a reference to requirements from the Department of Labor and Industry. And if you were to click on that link, it would provide you with this pop-up here. And so you can see what L&I requires for safety and health requirements for workplaces. If you were a state agency, this would be your roadmap. So instead of this fairly small, limited plan template, this document is pretty detailed. There's a lot of stuff in there. And so even if you're not a state agency, if your organization is fairly large and complex, I think there are some good things in here for you to reference and see if it gives you any good ideas for ways to develop a plan for your organization. Back to L&I. L&I has some resources as well, as you can imagine. I mean, all of these places have a million links that you can find information. But some of the things that you might find on the L&I website are guidance for specific sectors that you might not see as much information in other places. So here's an example for grocery stores to keep workers safe during a pandemic. Department of Health is obviously very involved in developing these guidance documents for the governor's office. And there are some great resources on the Department of Health website itself. And for example, for food service employees, there's some good information. But what you're going to find is really a lot of the states, and Washington's no different, are taking their cues from the federal CDC. And I certainly find that the state guidance is an important starting point because it does answer the questions, okay, really seriously, what is required for me and my organization? But it's common that some of the content is not as detailed as what you might find on the CDC. So, and I also frankly find the CDC website a little easier to navigate. So I spend more time on the CDC website than a lot of other places when I'm helping people develop a plan. And there is, oh, and I'm sorry, I don't have the slide for it here. The CDC does have a checklist that you can find for workplaces to reopen. It's similar to some of the other checklists that you're going to find in other places, but it is a useful tool. Federal OSHA, I think, has some good content, and there's a couple of things here. First of all, federal OSHA, I think, really caught on and uses language perhaps a little more clearly than others on the need for risk assessment, or they call it hazard assessment. But recognizing the starting point is thinking clearly about your specific operation and the specific areas where you might have an increased risk of transmission and developing a tailored plan for that. So a lot of these other places have these sort of templates and checklists, And it's great, those templates and checklists can be useful, but at the end of the day, what you need to do is recognize what are the practices important for your specific organization. There isn't going to be a one-size-fits-all plan because everyone's operation is different. And federal OSHA, I think, highlights that better than most. And they also have not only the guidance on preparing a place for returning to work, but this is very recent, this guidance on returning to work. And again, they talk about that hazard assessment, or I would call it risk assessment. And let's not forget that counties have information. The Clark County website, for example, has a lot of information. Well, it has a lot of information. It has some very useful places to download signs that you can use, and the data on the latest, greatest understanding of cases through the county, and the status of the phase, the application for phase 3. So it's worth time to browse the county website. I'll say at this point, you're probably now getting most of what you're going to start to see a lot of repetition. Once you get through the state and the federal guidance, the resources you're going to find in other places are going to be similar flavors to what you've already seen. It's going to start to look very familiar to you. And how can I not include the useful tools of the Greater Vancouver Chamber of Commerce? And I think this is a good point for me to let Abby lean in and your background with this, Abby. Do you want to say a few words here?
Okay, there we go. Yes, I would love to. Thank you. And Bill kindly provided a couple of slides here that I just wanted to touch on and to say thank you as a chamber member. So MFA is a member of the chamber, but also it's been a pleasure to be a part of the committees, to see everything that's going on in the background, and to work with the staff like Janet and Hadley and Sarah, who are, you know, keeping things moving for us all. They pivoted really quickly to providing resources on the web, providing webinars like this that we can access virtually, and tools that we could all use to get through this pandemic. And Bill, if you would, can you go to the next slide? And I just wanted to point something else. I know you're going to talk about this, but I'm going to get ahead of you for a second. Sorry. So the AWB has provided some fantastic resources, which of course you can find on their page, but to make it easier for us all and accessible in a place that we're used to going, the chamber has linked everything here. And I won't go into too much depth, but I will say that one of the things that I had found extremely helpful, and I think it could be really helpful for other folks, is if you scroll down farther on the COVID page at the chamber, below this section, you'll see tools that you can personalize signs, you can personalize stickers. There are templates for tons of different things that you can make fit your business and print them out. And they sure look a lot better than what I probably would have done, which would have been a marker and some of my kids' drawing paper. So thank you to the chamber, as always, for all of the wonderful resources and for helping us get through this and not have to reinvent the wheel, just making one thing a little bit easier.
Nice. Yeah, no, I agree. I mean, we're now at the stage of this summary of moving from requirements and rules that might apply to you to a bunch of smart people who are doing their best to give you resources to help. And so here's another good example of that. So despite their tragic name, the American Industrial Hygiene Association has a bunch of smart people that put together some really helpful tools. And I find that this is a lot more detailed and could provide you with a lot more concrete ideas of how to implement some of this guidance. So for those of you, and there were many in the poll at the beginning that said, yeah, look, I get it. I don't know if I need to have someone tell me again what the guidance says. I'm looking more for how do I really make this real and apply it in my organization. There are some good resources here for you. And also Impact Washington has provided some really good resources for manufacturing facilities, at least. And even if you're not a manufacturing facility, I've found that some of the resources here are helpful. So sounds simple, right? You just go through the million slides that I just covered in about 30 seconds and memorize everything they say, and now you just dive right into developing your plan. And I don't know, maybe you do feel overwhelmed, maybe you don't feel overwhelmed. I hope you don't feel overwhelmed. I hope you recognize it for what it is, and I alluded to this before. a lot of the fundamental information you find in the state requirements and CDC are going to echo through all of these other guidance documents and tools. So it's going to look very familiar. And so just take a deep breath and realize you can do this, but it's possible that you'd benefit from starting with zooming out before you get into the weeds. I would encourage everyone before they develop a plan, don't just go grab a template and start filling in your company name and just following the ant trail, but think broadly about what are you trying to accomplish? And I've got some examples of goals that you might identify for your organization. I would encourage you to come up with your own goals, which may or may not be these. But recognize that the plan you develop should serve the goals that you identify. You shouldn't have anything in your plan that's unrelated to your goals, and you certainly should make sure there is something in your plan for every goal that you identify. And at that point, I think you're ready to really think through, okay, who is going to be on your team to develop this plan and implement it? And what's the expertise that you need? Simple organizations that don't have a lot of moving parts are not going to need a team of PhDs to put together this kind of plan. But complex organizations that have a lot of issues to manage, you might really need to bring in people that have some expertise. So this is an example of the kind of plan considerations that I would have in anybody's shoes going through this process. I'm going to say a few words about each of these, and remember, I'm not here to give you yet another checklist of or template for a plan. What you call these things and what order they're in is entirely up to you. But I think what you're going to see as you look through all these other guidance documents, there's some flavor of this in all of them, even if they don't use the same words that I have up here on the screen. So my favorite starting point here is the risk assessment, because this really does inform the details of your plan. So for those of you who said, hey, look, I really want to know what I'm supposed to do in practice, not just what are the theoretical requirements. By risk assessment, what I mean is think clearly and systematically about your operation. For simple organizations, this might be just a mental exercise. For complex organizations, you might literally map out your processes and break them into nodes and go through piece by piece and thinking about scenarios in which you could imagine transmission. And then it could even be formalized. You could have a risk rating system of a scale of 1 to 3 for the frequency and the intensity and prioritize your recommendations. But all of that would really just be window dressing around the fundamental principle of systematically evaluating ways in which transmission can occur and identifying good recommendations to minimize the risk of transmission. And this example I have up here from the Pennsylvania Department of Health, I thought was pretty nice. It's not perfect, and I'm saddened that I don't see anything similar for the state of Washington or the state of Oregon. Now, it's entirely possible it's there and I just haven't seen it, so I apologize in advance if that's the case. But here's one example of a tool you can use to make the light bulb go off about, oh yeah, you're right, I hadn't really thought about that. Our plan needs to address those sorts of risks too. So think very clearly about your operation, and that will really help inform the details of what should you do in your facility. This is another point where I think I need to just step aside and let Abby jump in here, because this is a critical part of a plan. And Abby, you want to jump in and talk about communications a bit?
Thanks, Bill. Communications, as the slide says, it is overarching, but it also is foundational. So all of the pieces that Bill showed just a couple of slides ago have an element of communications to them, and they also address or will be received differently by different audiences. So depending on who you're talking with will depend on how you communicate and what is communicated. So keeping people safe, right? Trying to keep people safe as they work in our facilities, as they visit our buildings, as they come in and are buying from our businesses. They all have different filters and how they're going to understand what safety means to them and what that looks like. Telling them how we're going to keep them safe. Reporting to regulatory agencies if that's necessary. What does that look like and how will we do that? Making changes to the plan as as requirements are updated. What does that look like and who do we have to report to and how do we share that with our internal and external customers? So fair enough, right? We all get that. But what makes this different is that it's not business as usual. We're in a crisis, and a crisis the likes of which none of us has ever seen. And crisis communications is just different. It's a different beast. There's a lot of fear. There's elements of fear among all of us, whether people show it or not. Good communications helps to reduce that and give people a little bit of a hold on the situation and helps to set expectations, which continues to reduce fear. We're all wondering, every single one of us, what's next, right? So not only what is the next crisis, what's the next thing that's going to be on fire, but also what is next in the plan or what is next for me. And good communications can help to address that as well by thinking ahead, anticipating changes, anticipating our audience's questions, and really leading into and getting ahead of the questions that they may have about reopening and about what's next.
Thanks.
Effective communications. Oh, excuse me.
No. Go ahead. I'm sorry.
That's okay. Effective communications around a crisis really smooths all aspects of operations and really, again, lays a foundation for future communications. So some of the keys to making sure that your communications is effective is ensuring that it's a two-way dialogue and that it's an open dialogue. So people can, your staff can come to you and ask questions. You're sharing proactively with them. You have information posted and available for all your different audiences. So it's really open and transparent. Being consistent and relatable. So this is something that we experience quite a bit in crisis communications when dealing with things like brownfields or contamination, for example. It's really hard for people to wrap their heads around the more technical aspects sometimes, especially if there's fear. And so we have to work really hard to make sure that what we're sharing is shared both in words and in ways that that resonate with different audiences. And it needs to provide a sense of understanding and ownership. So again, helping people to relate to the information, to understand it at whatever level they are at, and then helping them own it a little bit so that they feel like they have some power in the situation as well. Good communications really does pay dividends in really every circumstance, and I know I'm slightly biased, but especially during crises, it establishes two things that we desperately need as human beings and as workers in difficult times: leadership and trust. So we cannot recommend strongly enough the need for a solid communications plan that interconnects with all different parts of your reopening plan, and that continuous two-way dialogue with your different audiences as we all work through and get through this together. So with that, I will get off my soapbox, and thanks, Bill. Back to you.
Well, no, thank you. I just want to make another plug here that communicating technical information under any circumstances is very hard, and particularly when it's emotionally charged like this. And I pride myself on being a reasonably good communicator, but working with Abby and other communication specialists, I realized that there is a different world, like many things, between someone who does something on the side and someone who their core business and they're professionals at something. There is a difference between that. And I am definitely an amateur compared to the communications group. And I really benefited from working with communication specialists and helping navigate some of these trickier issues. So in addition to the communications, you're going to find that there are likely going to be changes you're going to make to the physical environment and the infrastructure. I mentioned plumbing here, for example, because of, as you may already know, concerns about Legionella and unused or underused plumbing systems that have been sitting stagnant for a while. There are some HVAC considerations. So your HVAC system can play a great role in helping reduce your risk, but a poorly designed HVAC system might actually increase your risk. So having some assessment of that HVAC system, and once again, all of these things go back to your risk assessment, and it's not going to be a one size fits all. What should your layout look like? Because people's operations are all different. Administrative controls are essentially safe work habits. So your plan should describe your expectations for the safe work habits, and the guidance documents and the requirements lay out a lot of what this should look like. I've got some elements up here in the slide. So you should describe things like hand washing and cleaning. And then your risk assessment is going to help you identify expectations for probably a small handful to maybe a large handful of unique tasks that are going to be a bit challenging. I have some examples up here of things like elevators or time clocks or deliveries or kitchens, but you'll probably have a handful of things like that, and you might make those expectations part of perhaps an appendix to your plan. So you have some general expectations and a core plan, and then you might have some specific requirements for certain areas or tasks. And just a shout out to another consulting company, just to prove that one consultant can certainly give kudos to another consultant. There's a firm out there called Forensics Analytical Consulting Services, and they gave us a great idea where they were using QR codes to post at their facility or at a facility where they did work. It was a large campus of a facility, and there's lots of different expectations as people move through. And so instead of giving people a 3-ring binder and saying, this is what you need to do in all these different areas, people could go and hit a QR code with their smartphone, and the expectations, for example, at a cafeteria might pop up and explain what they need to do. I thought that was a really clever solution. Cleaning protocols. There's lots of guidance on what people should be doing for cleaning, and I'm not going to go through all of that here because you can all read for yourself. But I do want to speak a little bit about these questions of QAQC. There's a lot of discussion about how do you determine that your cleaning was effective. And you might have heard a number of conversations about, well, should I or shouldn't I do some sort of environmental testing? And then again, for what? Some sort of sampling to demonstrate the cleaning was effective. My suggestion to you is to think clearly about that. And I'm not going to say if it categorically makes sense to do that or categorically never makes sense to do that. There might be times when there's value in that. But it's not straightforward. And so just assure that whatever you choose is based on sound science and the guidance.
Bill,
personal, yeah, go ahead.
Before we go on, we've got a few questions here.
Yeah, let's hear.
Do we want to address? Okay. So we have a question here from Lorraine Williams. She says, our engineering office, Vancouver, does not have clients visit. We serve nationwide. Many of the regs cover places with visitors. Our receptionist is kind of freaked out by all the requirements, thinking that they apply to us as well. Any recommendations for non-public office spaces?
That's a great question. Well, first of all, anyone who's freaked out, I would say, let's calm down. We can make it through this. It's about mitigating risk. It's possible to do it. MFA is in a similar boat. We do have some people come in for deliveries. We occasionally could have a client come in, although certainly these days that's not as common. And so there are things that need to happen even in that kind of a space, but you're right, it's a lot less complicated when you're not dealing with people just walking in off the street. I mean, the difference between managing a grocery store versus an office like this is a world different. I guess what I'll just say is go back to my point about a risk assessment. Look clearly at where the risks really are. And I'm just going to presume without knowing that the risks are going to be fairly similar for that office as they are for ours, which is we need to assure that the workers in the office are separated sufficiently. We need to look at our ventilation system and see, are we maximizing outside air and getting the best filtration that we can get? And if we don't have much of an option for outside air or good filtration, you might consider supplementing with some of these portable HEPA air purifiers, because what you can do, and again, staying on filtration, not on stuff like ozone or things like, stay away from that. But anything that you can do to reduce concentrations in the air reduces your risk. and developing procedures to minimize the potential for people to be handling the same things without it being either the thing being cleaned or people's hands being cleaned in between. So I would say, yes, you can calm that person down and say there's a lot lower risk for a place where there aren't people walking in off the street. But at the same time, there are things that should be done to minimize the risk, even in that kind of an office.
Thanks, Bill. We have 2 more. We
Okay.
have a question here that says, should my company invite specific consultants to train my managers and staff?
Well, yes, and it should be us. No, I'm just kidding. I do think that all managers and staff should be knowledgeable. That gets to the communications piece, and you should have a plan for effectively communicating the plan. And how you do that is largely up to you. If you have people in, that's when I got to the point of, what do you need on your team? What sort of expertise do you need? You might have people internally that are going to be really good at that, and they can get the message across easily. You might not, and that's a great time to call someone and see if you can get help. And certainly we would love to help in a situation like that, and I don't want to pretend that we're the only people that would be good at helping people with something like that.
And one more question. Should my business's COVID-19 crisis communication plan be public to my customers, or is this just something just for my internal team? I can take a stab at that one if you like.
Please do, please do. Yeah.
Okay, and of course, Bill, if you have comments, I'm sure you'll add. So I recommend that your crisis communication plan is an internal document that is woven throughout the larger plan, the larger reopening plan. However, the pieces of your plan that are public facing would be something that then is implemented, if that makes sense. So maybe they don't see the plan, but there are pieces of it that are public so that people can see that you are taking steps to ensure the health and safety of your workers, of your visitors and customers. You're communicating via the plan to your customers, maybe through social media. So if you have a Facebook page, for instance, restaurants are really good about this. When they were reopening, saying, hey, we're reopening and these are our requests of you. Please wear a mask when you come in. Please wear a mask to go to the bathroom. Please use hand sanitizer, and our tables are going to be more than 6 feet apart. So those are pieces that you can communicate from your plan, but the plan itself really is an internal document, in my opinion. Bill, anything you want to add to that?
I totally agree. I mean, I could not have said it better, and that was my point when I said you should really work with professional communications folks, because as Abby just demonstrated. The thing I would add, and I'm just going to keep harping on this because I think it's so important, your decision about what to do with your communications plan should be informed by the goals that you set at the outset and the risks that you identify. So it's possible one of your goals is to maintain trust with either customers or your colleagues. And if that trust is, if you feel that trust is best served by being 100% transparent with your communications plan and the if-then plan of if this happens, here's how we're going to communicate, then great. However, I would doubt that would be the best path to build that sort of trust. Instead, I think, just as Abby said, there are going to be things that your communication plan directs you to make publicly available and to communicate. So for example, to communicate the procedures and safeguards that you have in place at your business, I think that makes perfect sense to communicate publicly. So anyway, with that, I think I realize we're running about, we're running a little bit shorter here, but Abby, are there other questions, or do we want to hold them for the question and answer period at the end, or?
That's everything we have right now, but yeah, thanks for the questions, and we look forward to hopefully hearing more from you in the Q&A.
Awesome, thank you. So a quick note on personal protective equipment. I recognize that in the eyes of OSHA or L&I that masks are not technically considered personal protective equipment, but I think to the layman, since masks are protecting others and not ourselves, that's why OSHA is very clear to say this is not PPE. But for most of us, I think we consider it an aspect of personal protective equipment. So you're going to need to be thoughtful about what personal protective equipment would make sense for your operation. And if you do have PPE that includes respirators as opposed to just masks, I assume you know this, but be thoughtful and recognize that L&I has some specific requirements for people wearing respirators. And if you're not aware of those, please learn about those before you start handing out respirators to people. I wish I had more time for this. This is one of the most important tools for some organizations. And I have really learned a lot from the experiences of some of the clients we work with. I'm aware of a food company that had a visit from federal CDC as well as the state health agency, not because they had such an incredible outbreak, but because they had such a limited number of cases at their organization. And they wanted to see what they were doing right, because a lot of companies similar to theirs had much larger outbreaks. And so they were hoping to use this organization as an example to hold up for others. And in the process of talking with this company, it became clear to me that a lot of the things they were doing inside the building were not that different than what all these other places were doing. But what was remarkably different was how aggressive they were with sending people home and paying them and not docking their sick time or their vacation time, so that there was no incentive for people to push through and come back to work until they were clearly not sick. And it certainly, I'm sure, created a lot of hand-wringing about the possibility they might be paying people when they didn't necessarily have to. But in the end, they made a business decision that it was going to potentially pay dividends for them to really focus on paying money on that end, rather than deal with the costs that could be associated with a larger outbreak. And boy, you know, no one knows what would have happened if they didn't implement that policy and how different life would have been, but it seems clear to me that this was a very important tool. So be thoughtful about your employment and sick leave policies and recognize how important that could be as a good tool to minimize spread. Your plan should count on the fact that somebody is going to test positive. You should not wait until the moment comes that someone tests positive to look surprised and then wonder what you're going to do. So have clear response actions in place. And again, there are many guidance documents out there that will help walk you through the details of a plan like that. But don't pretend that we can guarantee it won't happen, because in all likelihood, it will happen. At least you're better served to expect it than the other way around. And as this morning showed, yesterday showed, this is updating and all the time. We are in the midst of a very dynamic period right now. And I don't expect that to change anytime soon. So you really, once you have a plan, do not believe that this is a document that you stick on your shelf and you say, okay, I'm done. This is something that's going to have to be a living document and evolve as guidance evolves, and that takes time. So count on dedicating a person or people to stay abreast of the latest, greatest guidance and be able to update your plan accordingly. So to wrap up sort of the presentation portion of this, just to highlight some of the main points. You do need to have a plan. You can't just make this mental. And there are lots of resources, as we covered, to help you develop that plan. And like I said, it's ironic but true that the bumpier you expect it to be, the smoother it will likely be. So do expect that there are going to be cases. Do expect that some things are going to go sideways, and have it built in how you're going to adapt to that. And just be ready. This is not a paperwork exercise. This is not a static, I created a document. This is about people. It's not about paperwork. So this is about activity and action and reducing risk. So your paperwork is simply a tool to develop a shared understanding of what the expectations are, not an end result in itself. So that's pretty much it for my portion of the presentation. Abby, if you've got anything to add, feel free, and then we can also open it up for any additional questions.
Nothing to add from me. We haven't received any more questions since we answered those, but we'd love to hear more from you.
I do have a couple of questions while we wait. And for those of you, again, the suggestion or the question box is in the right-hand side. If you're joining us by cell phone, you probably do not have that capability. So it's not something you can find on a mobile version. But I do have a couple of questions, and I'll start off with a comment. I'm really glad you guys brought the communication portion into it. We're all looking at checklists and what we need to do as far as cleaning and masks and keeping people safe, but oftentimes it's the communication and the crisis communication plan that's really important. And Bill, you mentioned the food company. Oftentimes, yes, we find the federal and the CDC often get involved with food companies because those are the ones that we see often. And I remember a couple years ago, even I was in an audience of approximately 1,000 food companies. And when asked how many of them had crisis communication plans, it wasn't very many. And it was those obviously along the West Coast that dealt with a lot of fresh fruit and produce that oftentimes get in the news for things you don't want to be in the news for. And I think, Abby, your comment about having that crisis communication plan, we don't want to be in the news. Your business can handle it. We've had some Clark County companies that have made the front page of newspapers and national headlines. However, the way they've handled it has probably saved their business and their brand reputation. And I can't say how important it is for us to think about that communication to save our brand. And if we can send this video off to others, people that we know in our lives outside of this region, even send it to anybody, any company that you know that would find this video welcome. I do have a question regarding HVAC because a lot of companies are under a landlord-tenant situation. And when you at HVAC, oftentimes you find that that's a rub with any type of organization is the HVAC that gets the last to look at. Does Maul, Foster, Alongi and organizations like you provide audits of HVAC systems and recommendations? Do you provide those to landlords if people wanted to approach a consultant to see, are we safe? Are there adjustments that maybe the landlord can make?
Yeah, we can do that. We do have a ventilation group and then a group of engineers who specialize in ventilation. And I sympathize with the point that it's a challenge when you're in leased office space. And again, I'll just use Maul Foster as an example. We have that same situation. And so our approach was to provide the guidance that we saw around HVAC and supply it to the landlord and say, hey, this is what we see as recommended for our systems. How can you help us assure that these recommendations are implemented, or can you help us assure these recommendations are implemented? And varying degrees of success. We have different offices, and some of the landlords were very responsive and other ones were less so. And we had to do an assessment to decide, look, in some cases, we feel comfortable the HVAC system is set up well and we don't need to do anything else. And in other cases, when we didn't think that there was an optimal HVAC setup, like I said, we supplemented with portable air purifiers to do something. You know, if we didn't have it and we didn't have control over changing it, at least we could do something. And we also, fortunately, have the flexibility that perhaps some others don't, is telework for Maul Foster is not as complex as it is for a lot of other organizations. We have the ability to do that. So we have that luxury in a way that perhaps other organizations don't.
Great. Well, I think that's it for questions. I would say thank you very much, Bill and Abby. This has been a great resource, not only for the Chamber, but for the community. For those that are wondering, we are going to be sending a follow-up email, and that's going to include the slides as well as a copy of the link to this video. It's going to be housed on the Chamber YouTube, so you'll always be able to find it there. A couple of weeks ago, we had partnered with Peace Health to get a data-based view on COVID and the health and safety aspects, and that's also housed online. And I would encourage anybody who's on this call or sees it, feel free to share it. Share it with your owners, your colleagues. I think it's really important that we get a good look at how to keep everybody safe And then again, hitting on that crisis communication plan, something oftentimes overlooked. Yes, I know, Abby, you smile on that, but it's really important. So I think we've brought a couple of really great pieces together with experts, and we can't thank Maul Foster Alongi enough, and you both for being here. So thank you very much. We appreciate it.
Thank
Well,
you.
thank you. I appreciate the opportunity for sure.
Okay. Well, everybody enjoy your weekend, and thanks for tuning in.